Hi, I'm Kyla Neal, and my topic for this project was congestive heart failure. I personally have experience with it due to some of my family members who have passed away, so thank you. So, congestive heart failure is a serious condition where the heart just doesn't pump blood efficiently, and the heart doesn't stop. Well, it does sometimes, but usually doesn't. The blood doesn't really get through. So, the National Heart, Lung, and Blood Institute says that approximately 5.7 million people in the United States have heart failure. There's usually no cure, which is pretty disappointing, but with the correct treatment, it can be managed and the person can live a productive and hopefully content lifestyle. So some causes of the heart failure would be coronary artery disease, which would be when they close and not a lot of blood can really get through. It makes it difficult, which can lead to heart failure. A heart attack, which would be a blockage, of course. So some other conditions too would be like valve disease, hypertension, diabetes, kidney disease, and just heart abnormalities that were there from birth. So some treatments that you could look into, some have medications or like devices that you can use to help your heart contract and pump correctly. Sometimes doctors try to fix it themselves, so like if you need to repair a valve or just to like help control the beat if it's too fast, they can do that too, maybe go in. There are some medications such as beta blockers, which they limit the reverse damages to your heart, which is really nice. They reduce signs and symptoms, which helps out a lot, which is also, like I was saying, help with the content of the life. They usually do help you live longer. Inotropes are also some medication. For people with severe heart failure, they use this in the hospital. It just keeps the heart pumping, so maintain blood pressure just to keep them alive at that point. There are multiple types of heart failure, believe it or not. So there is a left-sided heart failure, which is the most common, and it usually develops as from a result of coronary artery disease. So the second one would be right-sided heart failure, of course, where the heart pumps blood into the lungs, which would technically be you drowning, and it collects oxygen from there, which you lose your oxygen. So then we have biventricular heart failure, and it only affects the oxygenated side of the heart, so it just kind of deoxygenates that side of the heart, and you don't get enough oxygen. Sorry. Diastolic heart failure. This is pretty common. I've heard of it a couple times actually. The heart is pretty stiff